This is October, which happens to be, by the way, Breast Cancer Awareness Month. And I think definitely this is something worth discussing. And we have an expert joining us, Dr. Brian Chon. He's a leading radiation oncologist with ProCure Proton Therapy Center in Somerset, serves patients throughout Jersey, throughout the country, actually, and even internationally. Let's say good morning to Dr. Chon. Doctor, good morning. How are you?
Good morning. Thank you for having me on. Thank you.
Oh, absolutely. It's a very important topic and a very, certainly with this being Breast Cancer Awareness Month. First of all, I know you could talk an hour for this about this probably, but just, kind of a quick synopsis. What is proton therapy? Because everything is changing so fast now.
Yes. No. Protons are simply the most precise and elegant way of delivering radiation treatments to cure cancers. So
Okay.
it really is the most sophisticated way of doing that today.
Okay. Now, what would somebody need to know as far as, once they're diagnosed? There's so many treatment options and places. What do you think that, a patient would need to know going in?
Yeah, no, you're absolutely right. One of the benefits of this modern age is that we have gotten so much better, and there have been multitude of new developments in terms of therapies. So sometimes the good news in that is also the bad news, where patients get quite confused, and it can be very difficult sometimes to navigate exactly the right path to go. Where I think the role of protons falls in for breast cancer specifically, I see a couple specific places where proton therapy could be very helpful. First is for patients with left-sided breast cancers. And let me explain why that's important. Historically, the way we would typically treat somebody with localized early-stage breast cancer on the left side is usually a combination of surgery, typically in the form of either lumpectomy, which is taking the tumor out,
right,
and the other being more invasive, like a mastectomy, which means removing the entire breast. And in certain situations, additional therapy like radiation was recommended to make sure that all the crumbs that potentially may be left behind after the surgery gets taken care of. Now, where the left-sided breast cancers are different is that the heart, which is sitting right below the chest wall, is often been the innocent kind of bystander to the beam path of the standard radiation. And, over the years, we've always known that we've delivered some doses we thought was relatively meaningless to the heart. But just a few years ago, there was a landmark paper that came out of Europe where they followed these patients with left-sided breast cancers for years, beyond 15 years. And it showed that, to everyone's surprise, that the folks who actually received radiation to a portion of the heart, on average, experienced a 35% increased risk in major heart toxicity, meaning heart attacks, fatal death.
Right. And logic would tell you when you're that near the heart that, it can't be good, obviously.
Right. That's exactly right. And the premise of our field has always been that basic truth, which is, number one, we know that radiation is both medicine and poison. And consequently, we need to avoid the healthy surrounding tissues, which could obviously affect the patient long after the years of cancer being cured.
Right. What should parents know, patients rather, know about proton therapy for breast cancer? Again, it's such a sea of information out there.
Right. Well, the first and foremost, I think people have to realize that proton therapy is just a more precise form of radiation. And so if your doctor, understanding the details of your case, recommends radiation therapy, and especially if you, again, have a left-sided breast tumor where you may have already received some chemotherapy that might be also toxic to the heart, it's very important to know whether proton therapy can be used to minimize the damage to the very important organs like the heart and lung. So I think it's very important to be able to either come and see us and speak with us, or certainly your physician, to see whether proton therapy makes sense.
Right. And so, it's like nothing in cancer treatment is for everybody. Some people are better candidates than others, I would think.
Oh, 100%. Yes. Again, we need to really tailor and individualize the case based on the specifics and also even some of the genetics and information that we have now going forward.
Right. And one thing from the little bit of reading I've done about this is and this is always I would think with a cancer patient, number one, their survival, situation, and number two, preserving vital organs and, minimizing side effects.
Yes, yes. No, you're absolutely right about that. I mean, I think in some ways now we are kind of seeing the unintended consequences to our success of maybe 15, 20 years ago, meaning, we've really done an amazing job in the last 15 years of being able to cure a majority of these early-stage breast cancers, which is terrific. But as we've kind of looked back on our success, what we've seen is also the collateral damage sometimes caused by the treatments themselves.
Of course.
And certainly as we have now long-term cancer survivors and people that are now living out their normal lives, unfortunately we are seeing the importance of minimizing these side effects in our patients. So, proton therapy is really a part of that solution, and hopefully in minimizing those side effects and maximizing quality of life for our folks.
Yeah, that's great. And we only have a couple of more minutes, but very quickly, Doctor, incidences of breast cancer, what are you seeing, especially among younger women? Because you're hearing more and more about it.
Yeah. As you know, breast cancer is a ubiquitous and very common diagnosis. In fact, it's the most commonly diagnosed cancer in women today. As we are now improving our ability to screen and discover these cancers now earlier than ever before through the advent of better imaging like mammograms and what we call 3D mammograms and also MRIs, we are seeing slightly what we call a stage migration. In other words, a higher incidence of breast cancers being found earlier on, especially with a condition called DCIS, which is a precancerous condition. And so this is really giving us pause now because, again, sometimes less is more. And we're taking stock of the fact that, again, we're diagnosing perhaps these precancerous conditions earlier than before. And we're wondering if the old ways of aggressively treating this is the right way to go. So, again, I think we're entering a new era where we're really trying to define how we can actually minimize these potential side effects, maybe by minimizing the treatments themselves.
Right.
And so it is an interesting time for us.
Yeah, I mean, in fact, that's the cover story of Time Magazine this week. Final thing, when a patient goes in, I mean, what can she expect for treatment?
Yeah, proton therapy is a non-invasive, painless treatment. From a patient's perspective, they're going to feel like they're getting an X-ray taken, meaning it takes only about 1 or 2 minutes for the treatment to take place. And again, you don't see anything, you don't feel anything, and certainly you don't hear anything. So it's a very, in some ways, an anticlimactic experience. But again, with the precision of proton beam therapy, our hope is that we can actually keep it that way for the duration of that patient's lifetime.
Yeah, we have come a long way. Wow, that's amazing. Well, Dr. Brian Chon, thank you so much. ProCure Proton Therapy Center in Somerset. Could you just very quickly just give out the contact information if somebody would like to reach you guys?
Absolutely. You can reach us on the web at ProCure Treatment Centers or call us directly. Our number is 732-357-2600. We have a number of leading experts are actually there and available to help you in any way. So feel free to contact us anytime.
All right. Super. I appreciate it. And thank you for some very interesting information, Dr. Chon. By the way, Dr. Chon, a resident at Harvard. You went to UMDNJ. You went to med school right here. You're local, although you mentioned to me off the air you're from Cherry Hill. So, my friend, let me say I wish you all the success and all your wishes in life come true, except when the Giants play the Eagles. So.
Well, maybe I'm changing my tune a little bit, but I'm sorry. I just still have that green running through me. I'm sorry to say that, but thank you so much for having me.
Yeah, last time I heard of somebody with green blood, they were a Vulcan, but anyway. All right. All right, Doctor, thank you so much. Appreciate it. You take care.
My pleasure.
All right, bye-bye.